Welcome back. This is Anesthesia 101 online.com. I am your host, Siv. This is episode, I want to say 3 or 4. I'll double check before I post it on YouTube, so we'll figure that out together. Today, I want to talk about the physiology of the neuropathic pathways that we get pain perception, and also the pharmacological agents we use to null the pain and get these individuals comfortable. So let's jump right into it. If I'm looking down, I'm looking at my notes. So I haven't said already that I'm not the smartest guy. So I have notes, and that's how we're going to work through it. So I'm going to share my screen. Here we go. Sharing the screen. Let's use this. Yes, we're going to share. And here we go. Here's the neural pathways we're going to look at. So let's start from the beginning. Let me scroll down a little bit here. So we'll look at those drugs in a few minutes, but we'll start with these as far as the physiology of it. And like I said, I'll be looking at my notes as we're going through this module. So there's different types of stages. Just transduction of pain, transmission of pain, and then it's perceived or perception, and then it gets modulated, as you can see here, and then perception. So first thing you're going to do is you're going to receive some pain receptors, be it trauma, some mechanical nociceptors, gets transmitted through your primary afferent neurons, specifically alpha beta fibers. That gets the input comes in as it comes in through your peripheries from your peripheral nociceptors through your peripheral nerves. You get your roots, and it gets transmitted through your dorsal root ganglion, goes to your dorsal horn. Goes into your spinal column, crosses over into your spinal thalamic tract. Specifically, when we're talking about these type of stages, we're talking about first order, second order, and third order. So primary order is your primary neurons, your afferent neurons that's coming in, your peripheral neurons. And then it goes to your terminates and your Rex 1 through 5. And as it reaches over and crosses over to your spinal thalamic tract, it goes up the ascending tract. So as it goes up the spinal column through your ascending tract, it goes up to your brain, and there's what we call the second order neurons. So at here, or this primary order neurons. Here, the terminates are here. This is where the thalamus and specifically the ventral posterior thalamus is located. So the lateral spinal thalamic tract leads here, and the anterior spinal thoracic leads here. And then we reach the tertiary or third order neurons. This is where all your somatosensory cortexes are located. All your what you perceive as pain is located. Your sensory cortex, your thalamus, the limbic system. And so it comes down your descending modulations, and that's how it gets modulated. So from there. All right, so that's quick physiology on that. Let's look at the pharmacological agents we use in anesthesia to date. So you'd be familiar that anytime we're about to have surgery, we have a timeout, and then you just use some kind of local infiltration. So when we talk about local infiltration, we're talking about these guys, your local anesthetics, your marcaines, your lidocaines, and what have you. So they usually inject into these peripheral nerve endings. This is where your local anesthetics work, and also this is where your NSAIDs work. And this is when we block patients. We're talking about the local anesthetic being deposited in your primary afferent neurons. This is when you're actually doing those peripheral nerve blocks. That's where you're hitting all those nerves. And in neurosurgery and sometimes orthopedic neurosurgery, they do put some local anesthetics in the dorsal root ganglion. So that's why there's local anesthetics there, here. So, and then you have the alpha-2 agonists. Specifically, when we're talking about alpha-2 agonists, usually come to mind is clonidine and dexmedetomidine Precedex. This is why these diseases are called centrally acting alpha agonists for pain. As we move in more medial, we'll get to the dorsal horns. So this is where all your narcotics, your GABA, pentanoids, and your and how I want to say the N-methyl D-aspartate are used, also known as clonidine, and then the gabapentinoids, also known as Neurontin. This is where all your drugs work. This is the site of action for them. let's move it further. Let's see if I can scroll down to this other module. And this is a little bit more detail. I got all these stuff from Medscape and like Google, so you can pretty much Google. Also, this always talked about the physiology of how they got pain, trauma, and went through the receptors, and then up to the crossed over ascending down to descending and dorsal root ganglion. So anyway, you'll see more paper being published now that they're starting to use some kind of antidepressants for these patients with chronic pain, and they're finding that the perception is what they got as far as like what hurts. But most it's beyond the scope of this module to talk about hyperalgesia and all that we come to know about. Right? So perception plays a role in that. That's why if you're looking at the antidepressants, TCAs, SSRIs, those play a factor here. So it's the perception of pain. So that's where those drugs work. And you have your alpha-2 agonist also works at the dorsal root ganglion. We went over that earlier. And you always, if you ever wondered where all your NSAIDs work, as far as your Tylenols, they work here. So acetaminophen, as you can see, it works at the modulation part, at the descending module, and it also works at the perception part. And it also works, I want to say it works at the peripheral part. Let me see, let's go down. I'm sorry, I keep doing this to you guys. It also works here. And when we're talking about NSAIDs, we're talking about coax2s, Celebrex, Praxin. So just a quick review on those. If you ever wanted to go through the inflammation pathway, look up inflammation pathway on Google, Dr. Google as I call it. And the other option you can look at is the arachidonic acid pathway, and that can break down the coax2, coax1, and it goes through leukotrienes, thromboxanes, and prostaglandins. So you can look at those. But specifically, we're looking at coax2, so will also be part of the NSAIDs family, and also ketorolac is part of that. Okay, that was quick and fast. A lot of physiology, but this is not meant to be an in-depth thing. It's more a review. So I hope you guys rate my channel. If you like what I'm presenting, subscribe to it. If you have a comment, please put a comment below. And if you're interested, in the coming weeks, I'll be launching my website, anesthesia101online.com. But until then, you can still email me at info@anesthesia101online.com. So you can info@anesthesia101online.com. So we'll have some stuff coming out. I'm working on a course packet, and maybe some trainings we can do together. So shoot me an email. Because of all the privacy laws that's coming out, the government regulations, I only use your email just to see if you like my product. Otherwise, I don't sell to third parties. Just a little disclaimer there. All right, I'll see you next time. I'm your host, Siv, and this is anesthesia101online.com. Thank you, guys. If you can stop sharing this here. And we're going to pause it here.